Good afternoon, everyone. My name is Eric Nowicki, and I'm a knowledge engineer at mTuitive. It's my job to take standards and content from different organizations to create digestible algorithms that can be turned into operative reports, checklists, and other features that are used by surgeons, pathologists, administrators across all segments of healthcare. Today, we'll discuss the Commission on Cancer and its newest standard-based requirements, the CSSP, or Cancer Surgery Standards Program. ACS, CoC, CSSP, what they all have in store for 2021 and the future of synoptic reporting. How it will affect each of you individually and the 1,500 accredited hospitals and facilities across the United States. mTuitive has been in discussion with the ACS for some time regarding surgical synoptic reporting and its usage for cancer surgery. And as a company, mTuitive will always provide leading technologies for tracking and reporting of any standards while maintaining, supporting, and distributing the latest, most accurate content available. Thanks again for taking time out of your busy schedules today to attend our meetings. My agenda for today will cover who these standards affect, what actually is the CSSP, which disease sites require reporting, how the required data elements are tracked for compliance, when is our hospital required to comply, why actually is the CoC requiring the CSSP, and how mTuitive can help with our hospital's compliance and the future programs that mTuitive and the CSSP have in the works. So who does the CSSP affect? Pathologists, surgeons, administrators, IT, and most importantly, patients. Many different people and departments will be impacted by these new synoptic reporting cancer standards. Although the American College of Surgeons is rolling the program out relatively slowly and in compartments, please don't let this fool you. They are bullish on their outlook for the program and believe it is the future of operative reporting. What is the CSSP? It's a subdivision of the American College of Surgeons Commission on Cancer. Specifically, the Cancer Surgery Standards Program boils down to the creation of evidence-based critical data elements for cancer surgery by a specific disease site. These surgical recommendations have been taken directly from the ACS's OSCS, which is the operative standards for cancer surgery. Which disease sites will the CSSP cover? The 2020 Commission on Cancer Accreditation Standards, Optimal Resources for Cancer Care, includes 6 new operative standards, standards 5.3 through 5.8, which are sentinel node biopsy, axillary dissection, primary cutaneous melanoma, colon resection, TME, total mesorectal excision, and pulmonary resection. How are the required data elements tracked and stored for compliance with the CSSP? Reporting responsibilities differ from standard to standard. Some are required to be completed by the surgeon of record. For example, standards 5.3 through 5.6 for breast surgery, colon resection, and melanoma all have critical data elements that require entries directly into the patient's operative report. These reports need to be made available for CoC site visits and their review. They now have become part of their accreditation process. For standards 5.7 and 5.8, TME and pulmonary resection, the reporting responsibility of the standards is the pathologist. These data elements need to be included in the pathology report in standard CAP synoptic format and are directly related to the surgical outcomes. These reports also need to be made available for CoC site visit and review and have become part of this CoC accreditation process. When is our CoC accredited hospital required to comply? For surgical standards 5.7 and 5.8, TME and pulmonary resection, the pathology standards, these standards become fully required as of January 1st, 2021. This is not a phase-in standard. They need to be in the report starting on that date. The critical data elements for these 2 procedures need to appear again in the pathology reports in CAP standard synoptic format starting on this date. For surgical standards 5.3 through 5.6, breast, colon, melanoma, there is a slightly different timeline. These are phase-in standards starting January 1st, 2021, meaning you're encouraged to start tracking them on that date in January of next year. However, the critical data elements for these 4 procedures must officially appear in all operative reports starting January 1st, 2022. So there's a 1-year grace period. The CoC site visits are used to measure a facility and its overall compliance with these CoC standards. Both these standards will now become an integral part of that process. So why is the CoC requiring the CSSP? They believe these guidelines give surgeons recommendations for the technical conduct of surgery and are based on the best available evidence. They firmly believe this is a step towards improving oncologic outcomes for surgeons. The CoC has invested time and done extensive research to create these evidence-based standards for these required disease sites. Compliance with these standards can be directly correlated with successful cancer surgery as well. Each disease site and data element were carefully researched and selected upon these merits. How can mTuitive help with our hospital's compliance? For standards 5.7 and 5.8 for TME and pulmonary resection, again, these are the pathology-based surgical standards. There is some good news. All mTuitive CAP e-form customers using the current version released of February 2020 will already be in compliance with these standards. By completing all required fields in the CAP e-form checklist for these disease sites, you will already be in compliance with the pathology-based CSSP standards, which is some good news. For the surgical standards, 5.3 through 5.6, the surgeon-based CSP surgical standards, the short answer is mTuitive's OpNote. mTuitive OpNote and Synoptic reporting in general reduce the time needed for an operative note versus regular dictation. mTuitive OpNote is a web-based platform which can be used for compliance with the CSSP, but also has the functionality built in to easily accommodate a full Synoptic operative report format. It's available either through an API, through a Smart on Fire application, or a standalone web-based application. Their surgeons will have the ability to open up this application from inside their EHR and complete the required data elements. mTuitive will manage all the content changes, expansions to other disease sites, versionings, and other applicable updates from that point. The platform will also have the ability to integrate with pathology and thus CAP form. What future programs does mTuitive and the CSSP have in the works? The 80-20 ratio refers to an operative report format containing 80% synoptic data elements and 20% dictation. This is a phrase I heard directly from the ACS in our meetings and shows just how important synoptic reporting is to their future plans. The CSSP and mTuitive both envision this program encompassing the entire operative report format in the near future. The CSSP is laying the groundwork to support a full standardized operative report containing, again, the 80% synoptic data elements and reducing dictation of these to 20%. mTuitive already has customers that use a full synoptic operative report format. With our relationship with CPAC, the Canadian Partnership Against Cancer, and with many of our ambulatory surgical centers, this full synoptic operative report is already in use. mTuitive has the ability to transform any traditional operative report into a streamlined full synoptic operative report, allowing, again, for more accurate and complete and efficient documentation of these surgical procedures. mTuitive and the CSSP are building modules into these for coding, staging, and then some other exciting things into the algorithms to help reduce on other redundancies and errors, and as well to save time throughout the operating reporting process. And lastly, the CoC will be expanding on these standards over the next couple of years from these initial 6 disease sites to upwards of possibly 60 disease sites over the next few years.